Hello my geniuses, welcome to my another head and neck lecture series today. So great science tutor Lorenzo. I'll be talking about the anterior triangles of the neck, and in my last video we talked about the posterior triangles of the neck. So we'll be talking about the anterior triangles of the neck. So in the anterior triangle is just viewing the neck. Just when you view the neck from the front, you see there are two bilateral projections in the neck, separated by the line from the jaw down to the jugular notch. The jugular notch is that hole in your neck where you can put your hand. That is the depression there. So if you take a line from your Adam's apple and draw it down to that depression, so that is the division of the anterior triangle of the neck. So I hope you are following me, and you're following me very well. So don't cram it, just understand it. So you can see the anterior triangle is a large triangular space on each side of the neck. So when you draw a line from the chin, or the chin where you have your bears in the middle side down to that side, you can isolate the halves for the anterior triangles of the neck. So what is the total boundary? So you are also seeing it, see it the way that's why I like showing you pictures. So anteriorly you can see the anterior median line of the neck. Are you getting now? That line that I told you from the chin, you draw it down. From the chin you draw it down to your Adam apple to that depression, which is your jugular notch. You get the anterior. So the anterior median line is very invisible. So in the posterior you have the anterior border of the sternocleidomastoid. Yeah, it's bordering it posteriorly. On the base you have the lower border of the body of the mandible, the lower border of the body of the mandible, and the line extending from the angle of the mandible to the mastoid process. So from the base of the mandible or the body of the mandible, you go to the angle. Are you getting that? Down to the mastoid process. So that's what you can see as the base. Okay, now so anterior is the anterior median line of the neck. Posterior is the anterior border of the sternocleidomastoid. Base is the body of the mandible, which extends to the angle of the mandible, which you are seeing on your screen. Angle of the mandible down to the mastoid process. Apex now, the apex is the is a suprasternal notch, which you are seeing, which is the meeting point of the anterior border of the mastoid and the anterior medial line. So that depression here, I call it the jugular notch, but it's just the suprasternal notch here above the sternum, suprasternal notch. So that place is where the meeting point of the anterior medial line and the sternocleidomastoid. Why the roof is the investing layer of the deep cervical fascia. The investing layer of the deep cervical fascia forms the roof. So you have skin, superficial fascia, then after superficial fascia you have superficial muscle, which is the platysma muscle, then you have the deep fascia, which is the deep cervical fascia, investing layer. Don't forget. So now in the floor you have the floor for the various triangles we want to mention. In the posterior triangle we only have one posterior triangle, with a division into two triangle, which is occipital and the subclavian. But for the posterior triangle you can subdivide them into four triangles. Makes up the posterior triangle, 4 triangles. So the first one is submental triangle. You have the digastric or the submandibular triangle, and you have the carotid triangle, and you have the muscular triangle. So don't forget it. We'll be talking about them one after the other. So the first one we're talking about, which is the smallest one, is the submental triangle. So look at the diagram of the submental triangle. So what is the diagram now? On each side, when you take that midline I told you, on the side of the submental triangle you can see what we call the anterior belly of the digastric. So the anterior belly of the digastric is by the side. Now what is the base? The base is the body of the hyoid bone. The body of the hyoid bone is the base, like you can see it on the ground. So you can see the apex, which is the so if you are standing in the submental triangle, you just look above you see the chin, the symphysis menti, which I'm talking about. The chin, you can see the chin there where the two mandible meets. So you have the symphysis menti, or you call it the chin. The base where you stand on is called the hyoid bone. You understand it, just feel it like the hyoid bone should be, imagine yourself standing inside that diagram and your leg is on the hyoid bone. So your leg is on the base while you are touching the apex, which is the chin or the symphysis menti. Then by your side, what can you see? The anterior belly of digastric muscle. Hope it's making sense to you. So what is the floor? The floor is, on the floor of the submental triangle is the two mylohyoid muscle. So the mylohyoid muscle is a suprahyoid muscle. So we'll talk about the suprahyoid and the infrahyoid. So the mylohyoid is forming the floor. Are you getting me now? So why the roof? Don't forget the investing layer of the deep cervical fascia. So we have talked about it. So now if you are inside that triangle, what will you see? Above will be the chin and the symphysis mentae. Below where you are standing on will be the body of the hyoid bone. We are imagining ourselves into the triangle, because that imagination makes you understand why by your side you'll be touching by your side the anterior belly of the digastric muscle, while your roof will be the investing layer of the deep cervical fascia, while your floor will be the mylohyoid muscle. So what can you see there? Remember, submental veins, are you getting me now? And the commencement of the anterior jugular vein, and you can see the submental lymph nodes, about 3 to 4 of them. Don't forget, submental vein, you can see the submental lymph nodes. Are you getting me now? So sometimes infection in the floor of the mouth, tip of the tongue, and the incisor seat cause painful enlargement of the submental lymph node. So the submental lymph node can get bigger when there is inflammation in any of the spots I've mentioned. The next one is the digastric triangle. So the digastric triangle, as the name is formed from the digastric muscle, or you can call it the submandibular triangle. Now the next thing is the boundaries of the submental digastric triangle. Anterior inferior. Now you can see your anterior inferior, so down. So if you are standing inside now, if you are standing inside in the anterior inferior part, downside, you can see the anterior belly of the digastric muscle, which you are seeing on your screen. In the posterior inferior, which is at the back, see in below, in the posterior inferior, what can you see? You can see the posterior belly of the digastric, which is supplemented by the stylohyoid muscle. In the base, what can you see in the base? In the base is the base of the mandible and the imaginary line joining the angle of the mandible to the mastoid process. So you can see the base of the mandible up. So if you are standing there, you are seeing the base of the mandible up in your superior part. Anterior inferior, you can see the anterior belly. Posterior inferior, you can see the posterior belly. The apex, what can you see? The apex is formed by the intermediate tendon of the digastric muscle. Are you getting me? So the intermediate tendon where the anterior and posterior belly of the digastric muscle meet. So that is what is forming the apex. The floor, what can you see in the floor? Don't forget, the floor is so easy. HMM. What is HMM? HMM is what? The hyloglossus muscle, the middle constrictor, and the mylohyoid muscle. Remember, in the submental triangle, you have the mylohyoid muscle, but this one you have the mylohyoid muscle with the hypoglossus muscle and the middle constrictor of the pharynx. Hope you are enjoying it. So what are the roof? So the next one is the roof. The same thing. The investing layer of this deep cervical fascia, which is splitted to enclose the submandibular salivary gland. So the deep investing fascia is devised to cover the submandibular gland. Don't forget. Same as it devised to cover also the thyroid gland in the neck through the pretracheal fascia. But in that one you have the pretracheal fascia. So don't forget, because first of all you have the investing layer of deep cervical fascia. Then inside you now have the pretracheal fascia and the prevertebral fascia. So, but for this one we have the roof. Normally is the investing layer of deep cervical fascia, which split to enclose the submandibular salivary gland. Now what are the content? The content is divided into anterior part and posterior part. The anterior part of the triangle, now what is it containing? The normal thing you have there is the submandibular salivary gland, the submandibular lymph nodes, the hypoglossal nerve, the facial vein. Are you getting me now? Lies superficial to the gland. You have, again, you can see on your screen, you have the submandibular gland so big resting on it. You have the submandibular lymph node, which is about 3 or 4 there. You have the hypoglossal nerve, which supplies the tongue. You have the facial vein, the common facial vein, and the facial artery. But the facial vein lies superficial to the gland. The facial vein lies superficial to the gland. The facial artery lies deep to the gland. You have the submental artery here, but the submental vein is in the submental triangle. And you have the mylohyoid nerves and vessels. The posterior part contains carotid content enclosed in the carotid sheath. But one thing you have to know, here is just containing the external carotid artery. while the internal carotid artery is in the carotid triangle. You get it now? While also enclosed by the carotid sheath. So in this place here, you can have the submandibular, or the digastric triangle is common site for swelling, especially when there's enlargement of the submandibular lymph nodes. You get him now? So when there is infection to the tongue or to the floor of the mouth or the frontal or ethmoidal or maxillary sinus, when there's inflammation there, the submandibular lymph node can get enlarged. And also it can get enlarged and spread out and cause so many issues. So most of these places, like the submental, it could be enlarged due to inflammation, same as the submandibular lymph nodes. The next one is the carotid triangle. The carotid triangle, because it contains the carotid vessels and the carotid sheath, so that's why it brings the name the carotid triangle. So what does the superior contains? So if you are in the carotid triangle, what do you see superiorly? The posterior belly of the digastric, which is always supplemented by the stylohyoid muscle. Now you have the anterior inferior, always is the superior belly of the homohyoid. So I know it as POS. Yeah, so POS, very, very simple. So POS, so the superior is the posterior belly of the digastric, supplemented by stylohyoid, P. The anterior inferior is the superior belly of the homohyoid. So homohyoid is the O, homohyoid, superior belly of the homohyoid. While the S is the anterior border of the sternocleidomastoid, which is S, sternocleidomastoid, POS. Now the roof is also the deep layer of the roof is always the investing layer of the deep cervical fascia, but you have the superficial, you have the skin, you have the superficial fascia, and you have this platysmal muscle, and also various parts. You have the floor. What is in the floor? You have your MITH, MITH. So when you remember MITH, you remember the floor of the carotid or triangle. So the first one is the mylohyoid, second one is HMM, third one, the floor, is the MITH, MITH. Yeah, and the boundaries are POS, don't forget. So all of them have mnemonics too, which I'll also be giving little by little. So what is the MITH? You have the thyrohyoid muscle, which is the infrahyoid muscle. Thyrohyoid muscle, you have the hypoglossous muscle, you have the middle constrictor, and you have the inferior constrictor. MITH, MITH. What are the content of this triangle? You have the carotid artery, which is the common carotid artery, which ascends into the carotid sheath. Now you have the internal carotid artery, which continues as the common carotid artery. You have the external carotid artery, which leaves, and its 5 branches. You have the carotid sinus. The carotid sinus is the dilation where the common carotid artery divides into internal and external carotid artery at the upper border of the thyroid cartilage. Now you have the carotid body too, which you have the carotid sinus, which I've told you about, but contains the pressure or the baroreceptors, while carotid body contains the chemoreceptors. You have the internal jugular vein, also enters, it descends through the carotid sheath. You have the 3 cranial nerves. The 3 cranial nerves is we have the vagus nerve, which is number 10, very important. You have the spinal accessory nerve, and you have the hypoglossal nerve. They are enclosed in the carotid sheath. Okay, now, but when entering into the carotid sheath from above, which descend to the carotid sheath, is 9, 10, 11, which is glossopharyngeal nerve, vagus nerve, and you have the accessory nerve, which is the cranial accessory nerve. But the one leaving is the spinal accessory nerve. You have the carotid sheath that encloses all the structures I've mentioned. You have the ansa cervicalis, which is formed by C1, C2, C3, which is C1, C2, C3 of the cervical plexus, which is located on the front of the carotid sheath. Now you have the cervical part of the sympathetic chain, which is posterior to the carotid sheath, and you have the deep cervical lymph nodes. So the major part here is just simple. It's just the internal common carotid artery, external carotid artery, the jugular vein, and the cranial nerves. Very easy. Now the last but not the least to all these triangles we are mentioning is the muscular triangle. So the muscular triangle is also very, very important because it contains muscles alone. Now the muscular triangle, you have the anterior is the anterior medial line of the neck, the anterior medial line, which draws from the hyoid bone to the supraspinal notch. You can see it, hyoid bone to the supraspinal notch. Now In the anterior superior, you have the superior belly of the mylohyoid. In the anterior superior, you have the superior belly of the omohyoid. In the posterior inferior, you have the anterior border of the sternocleidomastoid. Don't forget. So easy. So now you have the anterior medial line. In the anterior, you have in the anterior superior, you have the superior belly of the omohyoid, and you have the anterior border of the sternocleidomastoid. So what is in this floor? What is the floor here? The floor is what? You have the sternothyroid, you have the sternohyoid, and you have the thyrohyoid. So it's the infrahyoid muscle except from the omohyoid. So we have 4 infrahyoid muscles. What are the infrahyoid muscles? The infrahyoid muscle are we call it TOSS, 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 mnemonic for short. Thyrohyoid, omohyoid, sternohyoid, sternothyroid. These are the infrahyoid muscle. So inside the infrahyoid muscle, they form the floor except from the omohyoid. The omohyoid is forming the anterior superior parts. You get it now? So giving you a check also, why it's important to know it, which all these things are the content. So the content, the floor is also the content of the muscular triangle. The floor is, which is what? Sternohyoid, sternothyroid, and thyrohyoid without the omohyoid. They form the floor and they also form the content. Why the roof is still the same normal thing? The investing layer of the deep cervical fascia, which contains superficial fascia. I get him now. On top of the deep cervical fascia, which contains what? Lymph nodes and the anterior jugular vein. So, giving you a toast now, the infrahyoid muscle now, which I'll discuss in my next video. So I hope it all made sense to you and you understood everything I've talked about in the anterior triangles of the neck. So if you are new to my channel, make sure you should subscribe and turn on your post notification button, so anytime I drop any video, you'll be sure to be notified. If you want me to make a video for you, put it down in the comment section. I promise when I see it, I'll make that video for you. So let us jump to another video again, which is the infrahyoid muscle. So I'll talk about the infrahyoid separate, talk about the suprahyoid muscle and what their importance and what they do. Bye bye.